the conda is in posterior and inferior position. All right, so that's very significant. You have to know this, because in centric relation, the conda is in the most superior anterior position. In the centric occlusion, then so now you have in the centric occlusion you have the conda, which is in the posterior and inferior position. Okay, so the Gothic arch tracing, it's Gothic. Okay, so make sure you look at it, memorize it. Okay, it's good to know. Make sure you keep that in mind. So the Gothic arch tracing is also known as Jesus tracing, and it depicts, okay, it shows border movement in the horizontal plane. So posset triangle. So posset has two S's. That's sagittal plane. And then you have the Gothic arch. Okay, this is horizontal plane. And so the Gothic arch tracing has been likened to the cross foot, and the apex of the cross foot is centric relation. Okay, so centric relation is the apex of the cross foot in the Gothic arch tracing. Make sure you keep that in mind. Okay. All right, so this is a cross foot on the Gothic arch tracing, and all right, so the blue here, the blue here represents, remember when we say the line, so you have to identify the cross foot is on the maxillary teeth. Is this right or left maxillary arch? That is the right side. Okay, so the blue, this blue here is pointing to the pointing to the non-supporting cusp. So that's a working movement. Okay, and the yellow is also pointing on non-supporting cusp. Okay, so this means it's a lateral trusive movement for the yellow. Okay, so blue here is going to be working, and yellow is going to be lateral protrusive, and the black one here is, and you have the maxillary arch shown, so, and the arrow is moving forward, so it means the mandible moves forward. So this is a protrusive movement. Okay, and the green is pointing to the working, to the supporting cusp. So this is a non-working. Okay, so the principles that we discussed in the previous lecture, now you can see that how they apply in this way. Okay, so on the lower it's the same thing, except that the black arrow here, which is shows like it's a retrusion. Okay, so the black arrow here is going to, it shows protrusion. Okay, because the arrow shows that it's on the lower, it's moving back, but remember it's on the arrow is drawn on the mandible, so it means it's in the actual opposite side, so it's moving to the front. So this is a protrusive, the black arrow represents protrusive movement. All right, so the border movement is frontal plane. So remember, the envelope of motion. So there you can consider three planes. You have the mid sagittal, the frontal, and also you have the horizontal. Okay. So the outer line represents border movements for the lateral excursion and opening. The outer line is this one here. Okay, that's the outer line. The inner eye drop. Make sure you know that. The inner eye drop represents mascatory cycle. So when you're chewing, that's how your mandible moves. It looks like it's moving a little bit to the right and then downward and then up, and you complete the cycle. But it's an interesting shape. It's a teardrop shape that forms. Okay. Okay. So forces of occlusion. So occlusal forces should be borne along the long axis of the teeth. The occlusal contacts on inclines are not desirable. So if you want to establish a nice crown which its forces are nicely well distributed, then you have to have occlusal forces which are directed along the long axis of the tooth. Okay, this promotes, if everything is healthy, this promotes stability of the occlusion. Okay. So the primary occlusal trauma. Primary occlusal trauma. So it's the number one sign of occlusal traumatism is mobility. Okay. When you know there's occlusal trauma, they're gonna have some mobility of the teeth. And fremitas, as we mentioned in the previous lecture, this is functional mobility. And this is functional mobility could be due to a lot of factors, but mostly it's from the clenching, okay, excessive forces on the tooth. Which ends up causing primary occlusal trauma. The primary occlusal traumatism is defined as normal forces on normal supporting structures. And when the prematurities and interferences are removed, then the tooth can be stabilized for several days. Okay, so you can see the center of gravity here of the tooth, and then you can see how much the forces are nicely balanced in this case. Okay. So it's the secondary occlusal trauma. So it's the normal occlusal forces on the abnormal or reduced structure support, reduced supporting structures. Okay, so you can see here the CEJ, you have some gingival recession because you have the root here. This part of the root is exposed and there's no gingiva. Okay, so this means that you end up having secondary occlusal trauma, meaning the primary problem here is that there's gingival recession. Okay, the secondary problem is going to be occlusal trauma or secondary occlusal trauma due to reduced periodontium. All right, so centric relation, as we mentioned earlier, you can actually guide the patient. You can ask the patient to relax, and you can guide the patient into CR. Okay, using a chin support or chin point guidance, and so the bilateral manipulation of the mandible conda is needed, and one of the preferred method ways of positioning the condyles in central relation is the chin point guidance. Okay. So some of these things are very self-explanatory. You just have to read them over and over and understand them. Okay. So centric relation, remember again, the position of the condyle in centric relation is in the superior anterior on the in the slope of the articular eminence. Okay. All right, let's move on here. Facebow. So the Facebows is very important. Okay, you have to now understand the purpose of a Facebow. So the Facebow, they relate or they triangulate. Okay, Facebow triangulates the maxillary arch to the orbitally hinge axis. So it triangulates the maxillary arch to the